Ever wondered why schools offer the HPV vaccine to girls but not boys? The answer is a bit more complicated than most people think. HPV affects both males and females. It can cause cervical cancer, but it can also cause cancers of the anus, the penis, the mouth, and the throat. So why were girls prioritized? When many HPV vaccination programs started, cost was a major issue, especially because initially the vaccine required 2 doses, so it was much more expensive to implement. In low and middle income countries like South Africa, public health programs had to make difficult decisions about how to prevent the most disease with limited resources. At the time, cervical cancer was one of the biggest health concerns, and it still is, because it's the second most common cancer among women in South Africa after breast cancer. And more than 90% of cervical cancer cases are caused by HPV. So policymakers prioritized vaccinating girls first. Not because boys can't get HPV, but because vaccinating girls was expected to prevent the largest number of HPV-related illnesses with the resources that were available at the time. But the conversation is changing. In some parts of the world, there's a growing number of men that are reporting HPV-related cancers, and it's starting to cause concern. And there are other populations, like men who have sex with men, who may not receive the same indirect protection from female-only vaccination programs. Because of this, countries are moving towards vaccinating both girls and boys against HPV. So if you've ever wondered why is it that girls receive the HPV vaccine and not boys in schools, it's not because HPV only affects women. It's because public health programs were trying to achieve the greatest impact with the resources they had at the time. So, knowing what you know now, do you think it's reasonable to prioritize girls over boys for HPV vaccination? This is part 3 of my HPV series. Follow along for the next misconception. And remember, I'm not here to tell you what to do, just here to make the science make sense.